This is St. Vincent's Health Talk, a video magazine with the latest news and developments from St. Vincent's Health Services. In this edition, as always, we start with safety first by highlighting the great catch of one of our associates. We welcome new leadership to St. Vincent's in Medicine and Cardiology. We celebrate the success of our capital campaign and introduce one of the new additions to the medical center, the Vinci robot. At St. Vincent's, we're investing in the future and working hard to be the hospital of choice for patients, employees, and physicians. Now let's turn to our news summary. We begin this edition of Health Talk discussing safety, just as we do each morning in Safety Huddle and at the beginning of each meeting at the medical center. In the past few months, the medical center has impressively increased awareness about safety with the rollout of numerous tools which will help us become a high reliable organization. Carrie Eaton, Chief Administrative Officer, discusses why safety is at the core of all we do.
Well, high reliability organization is really just what it says it is. It's that you should be able to rely on the organization to do the right things for patients all the time, not just some of the time. And there are certain behaviors that are associated with high reliability organizations. One of the things that we learned was that there's behaviors associated with, for example, always making sure that patients don't get an infection when they're on a ventilator. And there's maybe 4 or 5 things that if we do it every time, we can make sure patients don't get infections on ventilators, where we used to think that that was sort of the cost of being on a ventilator, that some people would just get ventilator-associated pneumonias. Now we found out that there's certain behaviors that if you practice them regularly and reliably, you can keep patients safe. And if you do this all the time, you can reliably not have a safety event for a patient when you're in the hospital. So our work has been to teach patients, or to teach our patients, our families, but mostly our employees, how to practice these safe behaviors so that we don't have unexpected adverse events for patients that are within our own control.
One of the elements of being a high reliable organization is to reward and recognize our safety heroes. In this episode of Health Talk, we celebrate the great catch of Leonard Adoricio from the pharmacy department. A perfect example of CUS, which stands for I'm concerned, I'm uncomfortable, we need to stop, this is a safety issue. Lenny's actions protected a patient from receiving an inappropriate dose of medication, even after he had questioned the order.
Yeah, even though a lot of times pharmacy work is done behind the scenes, we're very proud to be a part of the healthcare team here at St. Vincent's, and our main job is to ensure patient safety, and we try and do that every day.
Four years ago, the leadership of the medical center put the first shovels in the ground and began the largest expansion project in the history of the medical center. Supported by the start of a capital campaign that was projected to raise $30 million in 2007, Ronald J. Bianchi, president of St. Vincent's Foundation, discusses the overwhelming success of the campaign, as the original goal was surpassed by almost double the projected amount.
St. Vincent's has not had a capital campaign since 1976, so we waited a long time. But the results were outstanding, far surpassed anything we could have imagined. We started with a goal of $30 million, and we're now closing in on our to-date goal of almost $60 million, which we think is possible between now and the end of the fiscal year. So we're moving forward at levels we just never thought were possible, and we did this as a group, a wonderful committee and wonderful volunteers, and we were able to accomplish this despite the fact we had one of the worst recessions ever since the Depression. And this recession didn't in any way hurt the campaign. It enabled us to still continue and do things that really helped the hospital and helped us build the master facility plan. It supported that, and it supported the robot. It supported step-down critical care units. We're looking to see if we can buy a hybrid. We're looking to help the college. So it's doing things that really touch many areas of St. Vincent's. We had 2 outstanding chairpersons for the campaign, Chuck Mattis and Jim Stapleton, who are members of the board of the foundation. And they did an outstanding job of representing the community and leading our campaign steering committee.
And now for our feature stories. In the fall of 2010, St. Vincent's welcomed our new chairman of cardiovascular medicine, Dr. Lawrence Scheck. Dr. Scheck comes to St. Vincent's after many years in leadership positions at Vassar Brothers Medical Center in Poughkeepsie. In his first few months here, Dr. Scheck discusses his vision for the future of the department.
We are going to be looking strategically to improve cardiology, to improve an already excellent product here through technology, through involvement with cardiothoracic surgery, and through involvement with our nurses to try to continue to provide some of the most compassionate and evidence-based care at the bedside. So this is a really exciting and I consider unique opportunity to come to St. Vincent's, and I have been very impressed with the entire cardiology service line.
Dr. Scheck is confident about the medical center's ability to continue to provide the highest level of cardiovascular medicine to patients and embraces the opportunity to lead the department through the coming years.
Nothing ever stands still in medicine, and cardiology and cardiothoracic surgery are constantly changing, constantly looking to improve the technology, the techniques, and also looking to expose patients to less risk at the same time, so that even though we come, or I should say I come to the program with an outstanding head start, part of the vision and part of the strategic plan is going to be to see what's out there and what we can continue to do to maintain our competitive edge and at the same time provide our patients with the best possible state-of-the-art care.
To the delight of the entire staff at St. Vincent's Medical Center, Dr. Mitchell Fogel was announced as the new chairman of medicine in November. Dr. Fogel, a 20-year veteran of the medical staff, is board certified in both nephrology and internal medicine. He was selected from a national pool of candidates. In his new role for only a few weeks prior to the filming of Health Talk, Dr. Fogel discusses his vision for the department.
One of the challenges that I'm most excited about is increasing efforts within the department and really focusing on patient outcomes and the clinical experience of both our inpatients and our outpatients. I think physicians are really going to be central to making healthcare work and making healthcare work better. And I'm going to be trying to get practicing doctors more involved in decisions about quality of care and initiatives and processes of care. I see the future of healthcare changing in ways that none of us really know right now. But I think increasingly we're going to be focused on outcomes. I think we're already seeing Medicare, and I think we're going to see other payers as well, stopping their emphasis on paying for things we do and really looking at the improvements that we do for our patients. And to do that, we need the cooperation of the practicing physicians, as well as the nursing staff, which are phenomenal here at St. Vincent's, the pharmacists, and the whole range of all the other support staff, including the discharge planners, and I could go on. And we all need to be working together, really focusing on improving the patients, I don't want to say experience, but the care that they get here, that we're doing things in the most professional way possible, the most effective way possible, and the most efficient way possible. Education is also an extremely important part of the medical center and especially the Department of Medicine. We have very strong teaching programs in internal medicine as well as programs in surgery and radiology, and we need to be training docs in the future for how they're going to be providing care in a different sort of environment. But I think education is more than just trainees, more than just residents, but also the attending staff. And we need to get them thinking about quality issues and understanding the role that they play. And the idea that they can just do their little job and that's all they have to do doesn't really fly anymore, because everything that the medical staff does impacts what the nursing staff does and impacts what the pharmacists do, and so on and so forth down the line. So the goal really is to try to focus more on clinical issues and try to be, again, working on efficacy, efficiency, and safety, and with a secondary focus as well on education.
Today, the Medical Center's emergency department is featuring more than a new state-of-the-art physical plant. Coinciding with the naming of the Michael J. Daly Center for Emergency and Trauma Care was the implementation of a minimal weight program, which has boasted impressive results and is quickly becoming the standard of care for emergency rooms across the nation. Patients are no longer experiencing anxiety related to long wait times or becoming so frustrated that they leave without being seen. Thus, the patient experience in the ED has resulted in dramatically improved patient satisfaction and safety scores. Dr. Jody Gerard, chairman of emergency medicine, explains the transformation of care in the ED.
In the past, a patient would come into a triage nurse, would get triaged, would come to a busy waiting room and wait. Then they would go see the physician, come back to the waiting room and wait. Then they would go to the registration booth, be registered, come back to the waiting room and wait. Then they would see the final nurse, get their instructions, their treatment, their discharges, their prescriptions, and wait until discharge. Now all of that happens at one time. Both Dr. Herman, a patient, the registrar, the nurse, sees a patient at one time. And so all of that duplication of effort is minimized. And as a result of that, we've seen dramatic changes in both patient satisfaction, the waiting time to see a provider, the waiting time to get upstairs, the growth in the revenue and in the volume of the emergency department as a whole, and if you look to your right, an empty waiting room.
As of this filming, the emergency department has reduced door-to-doctor time to 35 minutes, with half being seen in 23 minutes, while also decreasing the percentage of patients who left without being seen from 3.9% to 1.2% since the inception of the program. Due to the overwhelming generosity of Elizabeth Freem, St. Vincent's welcomed the intuitive surgical Da Vinci SI system last year, and training in specialized surgical areas continue for our medical staff surgeons. Approved by the FDA for multiple surgical procedures, the robot, unlike most surgical instruments, can enhance human capability. Chairman of Surgery, Dr. Douglas Ross, explains the advantages of this robotic technology for patients.
Well, this Da Vinci robot is the latest model of the Da Vinci. It provides a high-definition 3D images through laparoscope. So, in fact, we get a much better picture even than the normal laparoscopic surgery. So that's number one. So that even the camera and the pictures coming out of the machine are much better than we've ever seen before. But in addition to that, this robot, because of its very small arms, can actually work inside the body in areas that are really very, very difficult for our conventional laparoscopic surgeons to get to and to work in. It provides a much more delicate and much more finesse moves in the body than normally could be done with the laparoscopic instrumentation. So this really helps both create a safer environment for the patient. Surgery can be done eventually faster in terms of the patient's recovery. The patient can get out of the hospital a lot faster, does not need to be opened up, have a large incision in their body made in order to do some very sophisticated surgery. So we're very excited to have the robot.
Training began in August and will continue so St. Vincent's can offer patients a full complement of surgical interventions in urology, gynecology, general surgery, cardiothoracic surgery, and otolaryngology with the assistance of Da Vinci. Thanks for watching St. Vincent's Health Talk. We leave you with some further images of our beautiful medical center and the staff that provides state-of-the-art care every day.